Hello. Today we'll discuss how pathophysiology helps in individualization and drug selection. Uh, for example, I will give you one case. A few months back, we had one young, rather middle-aged man, 53 years. He had come for bilateral pain, that was osteoarthritis of knee joint. We inquired further, but there were no modalities, guiding the selection of the drug. Casually, we saw his leg that both legs have varicose veins. And then while talking, he said he also gets pain when he walks for a longer distance. And the remedy is he comes home and lies down with the legs elevated. That gives us, the additional rather information in the sense that probably varicose veins and vascular insufficiency causing the leg pain. So, considering that, we gave him Vipera, which not only relieved that leg pain but also the knee pain for which he had come. So, the consideration of what is going on inside the body, pathophysiology, is very important. Another case I will narrate. He was a young man and he came for just casual loose stools 3-4 times a day, not too much of it. He used to get urge, he has to go, and then for a while he will feel better, but again that urging will persist, and when he goes, he was better only for a while. Now that is naturally points to Nux vomica. We gave Nux vomica, he was better, but mild pain still persisting. Then we asked for stool examination, what is going on exactly. So we found a few leukocytes in the stool, and now that naturally indicated that a sort of mild inflammatory process still remains in the intestine, or more specifically colonic area. And then we gave tuberculinum 1 dose, which comes often for the post-inflammatory effect of anything. So with that 1 dose of tuberculinum, he was perfectly fine, and that's how again the pathophysiology, the finding of leukocytes in the stool indicated tuberculinum, and that's how pathophysiology helps in individualization and drug selection. Third example, this lady came to us after having treatment for dry cough from another colleague of our profession, another physician, homeopathic physician, and he gave her the usual drug, the bryonia and Rumex and all that, whatever indications were there. But there was no change, and the dry cough was troubling her for quite a long period, maybe a couple of weeks. We inquired about the further what else she had and all that. So she said she is used to get, or rather she gets attacks of acidity sometimes, intermittently, and for that her remedy, okay, don't eat chilies, and she takes milk and this and that, and that gave us some indications in the sense probably the acid reflux may be causing irritation in the throat, and that may be responsible for cough. Along with that, another symptom which she gave, that okay, whenever she has acidity, she takes something cold milk, something cold, and which is relieved. Now that reflux acidity causing cough and that symptom related to that acidity pointed towards phosphorus. We gave her phosphorus and she was perfectly alright within a couple of days. So this is how the pathophysiology, what processes are going on in the body, will help us in individualization, which is a very important aspect of totality. Next time we'll continue with the totality. the consideration of general symptoms in the totality. Thank you.